Dr. Lavan again. So today I have a wonderful pleasure of having Tim, one of my good friends, who actually runs Surrey Physio. Now they're a company we work with Croydon as well as Sutton, so in both my practices, and they provide wonderful care, especially for my practice in Croydon. As you may know, with these new primary care networks where we're getting practices working together, we actually have some of Tim's team coming and joining us, and they actually see a lot of our patients. The lovely thing about this is, as much as GPs we like to think we're the best in all areas, things like musculoskeletal need that really good specialist care. And as we've discussed in previous videos, especially when we were talking about knee operations, this idea of having really good prehab as well as post-hab, it's really, really important that we do these exercises very well. And actually having a physiotherapist who can run through the exercises with you properly. Just having a leaflet or just following online doesn't always help. Having an understanding of maybe the anatomy and how muscles and tissues work is always really good. So today, Tim, thank you for joining us.
Pleasure to be here. Thanks for asking me.
Thank you. I really appreciate your time. I thought today would be a lovely opportunity to discuss two big subjects. And I wanted to think of subjects that would probably apply to COVID. Now, what does that mean? So now that a lot of us actually working from home, so we get a lot of patients that come in, office workers who are saying, I'm working from home, my neck's aching, my back's aching. These are two big areas that I think we talk about the spine a lot being a really important part of our whole structure. And I thought maybe if we focus on those two areas, because surprisingly, if you think about neck pain, a lot of people come in saying, I've got headaches, and we look through, have they got low iron? Are they drinking enough fluid? Have they had an injury? But in the end of it, we actually speak to physiotherapists because we find that there's an issue at the back of their neck and that pain radiates. So I think today, if it's okay, Tim, we'll talk about neck pain. And at the end, if it's okay with you, maybe run through a few exercises that we could do to try and prevent that.
Let's do that.
Perfect. So what's your experience, Tim, with neck pain? Is it a big problem that you see? Is it something that, actually no, I see my carpal tunnels, I see my hands, or is neck quite significant?
Yeah, neck is very, very significant, and it's been a very significant problem since lockdown. Now, what we're seeing is a lot of laptop-related neck problems.
Okay.
And I guess I'll try and make it visual for you.
Yeah.
But imagine that you're on a laptop on your kitchen table.
Yes.
Like many people throughout the country, and you're in this position.
Oh, yeah.
Okay, now, there's a big problem with being in this position. Okay, the big problem is your head weighs 8% of your body weight.
Wow.
So let's say that's about, let's say 8-9 kilos.
Yeah.
Right? Yeah.
Fair.
So let's say your head weighs around 8 kilos. Okay. Now that's 8 kilos of weight that has to be supported by your neck muscles.
Yeah.
Now imagine you put that 8 kilos of weight and you bring your head forwards.
Right, gosh, yeah.
Now that's now 8 kilos of weight plus gravity pushing down.
Yeah.
But those neck muscles have got to try and support that weight. Now when you use a computer on a desktop, you're much more aligned. So your screen is higher.
Yeah.
You probably be a bit more upright.
Yeah.
As soon as you sofa surf, or you sitting at the kitchen table, or you're lying in bed, your neck is bent forwards, your head comes forwards.
Yes.
So you've got to support those muscles, your head, and the weight from the muscles,
Wow.
which is a big problem. Now, you do that for 10 minutes, you'll probably feel it in your neck muscles. You do that for 8 hours.
Yeah.
And you imagine all that weight. It's like holding imagine you get a bucket of water. Of 8 kilo bucket of water, and you hold it out here.
Yeah.
It's a lot heavier here than it is here. It's
True.
like holding a baby in a carrier. When you hold a baby, you always want to hold them close to you.
Yeah.
Because there's a lot less weight, because it goes through your centre of gravity.
Yeah.
As soon as you hold it out,
Yeah.
it's much more stressful on your spine and your muscles. That's when you start to get neck ache.
Right.
And when you start getting neck ache, and I put my hand up because I've been a headache sufferer.
Oh, right.
You start to get headaches. They're called cervicogenic headaches, cervico-neck-genic origin, neck and origin headaches.
Great.
And they're often caused by stress going through the neck and long hours on laptops and computers and iPhones and phones and tablets, because they all encourage us to drop our head forwards.
Wow.
And that's the biggest cause that I see of neck problems.
Wow, okay. And I guess the real question to our followers, can it be fixed or can it be improved, or is it something that we're going to have to live with?
It can always be improved. And you know what? There's so much you can do. I think the first thing is awareness.
Yeah.
You be aware, or if you start to get neck pain, just first of all, be mindful. Think to yourself, what am I doing? What am I doing? What's changed in my life to cause neck pain? Because often, just identifying the cause, you can reverse the cause by avoiding the things that are causing the neck pain. Okay, so identification. And number 2, exercise. Just go out and get fit. Like, don't sit in the computer for 8 hours a day.
Yeah.
Break it up. Go for a walk for 20 minutes.
Yeah.
You know, just why? Because it changes your posture, it changes your position, it improves your fitness. It's good for your heart. It's good for your body. It's good for your joints. It's good for the bones. You know, I know gyms are currently shut. They are due to reopen, but getting exercise, going exercise, doing Pilates classes, doing gym classes, doing spin, swimming. It's good for the neck, it's good for the body. Number 3, you can do neck stretches.
Okay, good.
You know, if the neck's tight, you can do stretches. A simple stretch might just be something like a neck extension or neck retraction exercise. I mean, if we know we're like doing this all the time, where our head is protracted, we call protraction.
Okay.
Why don't we just do a gentle retraction exercise, just to
Great.
like start to get more aware of where our head is in space, where our posture is. Let's just start to bring our chin back and just hold that position. And let's start to strengthen the front of our neck muscles rather than the back, which are getting worn out through constantly being under load. Why don't we do a neck extension exercise? Just to get used to our neck going backwards. The neck is designed to go backwards, but how many people never put their neck backwards? But why not? Our neck has a curve that allows our neck to go backwards. But we very rarely look into the distance. We very rarely look into the horizon. We very rarely look up at the sky. But why not? We don't look up at trees.
Yeah.
You know, we want to encourage our neck to go backwards because we spend our whole life with our neck forwards.
True.
Yeah, so let's do some neck extension. We can do some neck stretches, like just holding the stretch. A good stretch to the levator scapula, a little bit to the sternocleidomastoid. I'm getting a bit technical, but just holding the stretch. You can hold it for 15 or 20 seconds.
Okay.
Feels great. What about a mobility exercise? You're sitting all day.
Right.
You're doing Zoom call after Zoom call after webinar. What about some stretches? What about just a gentle twist stretch? Touch the back of your chair 10 times each side. Or neck rotation, looking left and right to mobilise your neck. Because your neck's stuck in one position. Let's get it moving. Joints need to move.
Yeah.
We've got 7 vertebrae in our neck. And these vertebrae love to rotate.
Okay.
So let's do some rotation on the neck. So there's so much you can do. You know what? Almost always pain in the neck or any body part can be reversed.
Good to know.
Now there are times when you get things like osteoarthritis, you know, degenerative change, and some people call it wear and tear. But even degenerative change can actually be managed with exercises. Because many people have some degenerative change in their neck, but not all of those people get pain.
Yeah.
So actually managing it with exercises and advice and guidance and the right things to do to not put stress through the neck, those people can significantly reduce their pain in the neck.
Wow.
So there's so much you can do.
Wow, I'm learning a load of information here, so I've got to take it all in and watch this video. A question I get asked, Tim, is obviously we kind of talk about the acute and the chronic, so obviously the ongoing neck pains, and that's easy for me as a clinician because I know, look, you're going to see a physio in a few weeks or a few months, but we can do certain exercises, and when you see them, they're going to get you sorted. Now, the ones I struggle with personally is I get that call on the day, or I've had a couple of days of really, really bad neck pain. And the question they ask me is, should I go for physio today, tomorrow? Because in one sense, I think, are you really guys going to really be able to do much at this stage because it's so painful? Or would you advise, actually popping in to see a physio to get some alleviation is an option? Or what are your thoughts on that?
Yeah, I mean, the thing about acute neck pain is hopefully it should just resolve. So with acute conditions do tend to suit themselves well to go to the GP. Pain medication and medication to help reduce any inflammation, or inflammation, things like naproxen, can be useful, sometimes coupled with omeprazole, or cocodamol. So we can medicate for it, you absolutely can see a physio. Now, some physios don't want to see it when it's too acute because they're a little bit nervous because there's probably a lot of spasm and inflammation. Some physios, like myself, I will treat them. I had a great one come in about 4 or 5 years ago. A patient, I'd seen him on and off for 3 or 4 years. I knew the guy well, and he phoned me in an emergency one Friday and said, "Tim, I'm in terrible, terrible trouble. My wife has woken up and she has a really, really bad neck, and we're getting married tomorrow."
Oh,
well, it wasn't my wife, so it was my client, due to be my wife, and we're getting married tomorrow.
Wow.
What do? I brought her straight in. I think I even came in from home to see her.
Oh, wow.
I brought her in. I gently mobilised her neck. We reduced the inflammation, got her ice net, got her on some medication, and she was largely reasonably okay for her wedding. It could have been much worse. She couldn't move that morning because she couldn't turn her neck. So at least she could have a fairly good day. So yes, we can treat it when it's acute. Now, bear in mind the realistic expectations. NHS, you're not going to get a physio appointment very easily next day. Yeah. And there are first contact practitioners who may be able to see you now, which is a national programme where physios are in GP practice, so they might be able to. But in most cases, you might have a bit of a wait for physio. So if it is acute, follow the advice of your GP first. And when it becomes chronic, then of course physio can also jump in. So we can treat it at both stages.
Great. And my last question, Tim, about the neck is just about when do we do scans, x-rays, MRIs. A lot of patients now, obviously with the capabilities we have, will say, "I've got my pain last few weeks, I need a scan." Do you guys actually need scans? Because there's a slight anxiety with me, and I feel sorry for you guys, is no one has x-ray vision. So when you have that patient, do you have any anxieties that, oh, if I touch that neck, I could make it worse? Or is there an understanding that, no, we can try something, and maybe if things don't progress, scan is sensible?
I mean, the first thing I have to tell you guys is that, first of all, the majority of GP practices in most areas do not have direct access to MRI scan. So going to your GP and saying, "I want a scan," it's really not going to get very far because there's no direct access. And even if the doctor wants to prescribe you for a scan, they probably can't. Right? Now, where there is access, there's also going to be very strong restrictions. They can't just send everybody for a scan. There has to be a criteria for getting a scan. So you need to meet a certain level of severity before you're going to get that scan. Now, certain things there are certain signs that there are called red flags where we think, wow, that could be something serious. And in those circumstances, most of the time the GPs will then refer to the musculoskeletal team, who can then get a scan or have access to scan, but you'll still have to meet that criteria. So my general advice is most people don't need a scan, but if things are progressing and getting very severe, you're getting nasty symptoms, shooting pains down arms, shock type pains, electric shocks running down the arms, any kind of change in visual disturbances, or vomiting, any kind of serious signs, fevers, weight losses, previous history of cancer, things like that. Your GP and physio will be able to spot certain red flags. We'll know if it's serious or not, and then we can escalate. Most patients don't need a scan. Most patients can manage with exercises, guidance, advice, physiotherapy, seeing their GP.
So we're with Tim for the last part of this, and this is doing the exercises. So we're going to start off with a neck exercise. So Tim, I'm a typical guy at work. I don't have the time, usual excuse. I'm having severe neck pain. I've come to you. I'm not in appropriate gear, but what can you do to help me?
Let's just get the neck moving. Let's get it mobile. So Lavan, just face this way for me. Good. Now all I want you to do is just gently and comfortably look gently over your left shoulder and then over your right shoulder. Okay, great. Move left and right. You want to focus on maintaining it within a pain-free movement. So don't go too far, just keep it comfortable.
Yeah.
And I want you to go 10 times each side. Great. You can do this 3 times a day. So it's just going to get your neck more mobile.
Great.
Okay, the next exercise I want you to do is just to bend your left ear down to your left shoulder. And now your right ear down to the right shoulder. Good. And to the other side. Okay, and so let's go here. Good. Bend to the left ear down to the left shoulder. Great. Right ear to the right shoulder. You're going to do that 10 times each side, and again, you're going to use it to help get that mobility in the neck. So it's just going to mobilise the joints. And why do we want to mobilise the joints? To get more movement and to reduce some inflammation.
Great.
Good. And let's give you one more exercise. So let's give you a gentle neck stretch. So we might go from a side stretch into a gentle neck stretch. So we're just going to gently pull the neck to one side.
And this.
That's it. Yeah. And hold the stretch.
Okay.
You hold it for about 10 seconds, maybe 15 seconds.
Mm-hmm.
And then you might repeat to the other side. It's going to help with some muscle tightness.